I'm Julia McCarthy, a Senior Program Officer with the Healthy Food, Healthy Lives team. Before we get started, a few housekeeping items. First, we'll be recording this webinar and a recap with the link will be shared afterwards. Video and audio are disabled for attendees, but we invite you to use the chat box throughout the event to share questions. And we have closed captioning available for those of you who'd like to use that feature, and you can find that in the top right. I want to start by saying that when we first conceived of this webinar, we weren't in the current situation we are around SNAP. So, with the shutdown, 3 million New Yorkers across the state are, at risk of losing their SNAP benefits, and we are very worried about that. I want to direct people to resources first to say that, the Office of Temporary and Disability Assistance has shared some resources there, just put into the chat. And just this morning, the governor announced initial funding for emergency food. At NYHealth, the Healthy Food, Healthy Lives team is working, right now to think about how we may respond to this. And there will be time for questions about all of these things and nutrition incentives at the end of the panel discussion. I want to start by saying, though, we do have this bright spot in this very dark time, and that is our existing nutrition incentive programs. And so today I'm honored to be joined by 3 guests who will help us better understand how those programs work in New York State. Here in New York, they've successfully increased the buying power of low-income individuals. They've helped people purchase more healthy food. And at a time when nutrition budget are being slashed, these programs really are helping people. But their scope and their reach was really not well understood until now. And so Field and Fork, in conjunction with New York State Department of Health, just released a landscape assessment of these reports, an assessment which really allows us to better understand how these programs might work to mitigate food insecurity in New York now and going forward. So without further ado, I'm going to turn to the speakers to introduce themselves. Jake, I'll start with you.
Hi, everyone. My name is Jake Kowal, and I am the program manager for Double Up Food Bucks New York with Field and Fork Network. Double Up Food Bucks New York is a SNAP matching nutrition incentive program that operates at grocery stores, farmers markets, farm stands, and mobile markets across upstate New York and Long Island. I was also one of the authors of the landscape assessment, so I'll be giving a brief overview of it to kick off. But I'll let Ashani introduce herself.
Hi, everyone. My name is Ishani Choksi. I am currently a fellow in a program through SUNY Albany. It's the Fellowship in Applied Public Health program designed for clinicians pursuing or interested in learning more about public health career. So I'm pursuing my master's in public health. My background is I'm a pediatrician, and I've been involved in various divisions in the State Department of Health, particularly with the Bureau of Community Chronic Disease Prevention, which is how I got involved with this landscape assessment. And I'll talk a little bit more about that later, but nice to meet you all. And Jeff, I'll pass it to you.
All right, thank you. Yeah, so I'm Jeff Cady. I'm the Vice President of Produce for Northeast Shared Services. We do the stores, the banners, Tops, Price Chopper, and Market 32. For those of you who obviously live in New York, I'm sure you know the banners. They're out there in spades. There's got to be at least a couple hundred stores scattered out throughout New York. I've been privileged enough to be in this the grocery retail industry since the mid-1980s. So this is actually my 40th year that I'm going, and I've been in produce the entire time. So very happy to be here, and I love produce, and yeah, that's me. Thanks.
Thanks so much, Jeff. Delighted to have you all. So Jake, can we start with you? You've just produced this report. What's a summary of the research? Can you share that with us?
Yeah, absolutely. I have a few slides to share because some of it is quite visual. Let me just share my screen here. Okay, perfect. And let me know if that looks good and everyone can see it. I'm gonna take that as a yes. Okay, I see a thumbs up from Julia. Perfect. Yeah, so to kick us off, so why did we do the landscape assessment? So it is a key project in a partnership between Field and Fork and then the New York State Department of Health, Division of the Chronic Disease Prevention, It was under the CDC SPAN partnership, which stands for State Physical Activity and Nutrition. Basically, we were trying to identify current fruit and vegetable voucher programs currently operating in New York State, with a focus on nutrition incentive and produce prescription programs. We had a pretty broad definition of those, which I'm not going to get too in depth on things. I would definitely recommend folks to dive into the full report, which we will share a link to. And one of the key reasons for putting this report together is look at basically potential barriers to participation from eligible New Yorkers, and then recommend some areas of opportunity to enhance program uptake with those groups. And again, we'll post the full link to the assessment later on. So across New York State, we identified 7 major nutrition incentive programs and at least 18 produce prescription programs, covering all counties across the state. And I'll just add a caveat there. While these programs did cover every county or had the ability to cover every county, there were major service gaps, so not all counties were technically covered. But they were at least in the territories of these programs. To dive in a little bit deeper, we focused in on 9 Western New York counties to really see if we could assess where those barriers were happening. We chose these 9 Western New York counties because it was a mix of cities, rural areas, suburban, and a pretty good snapshot of the state of New York. So diving into those counties, this is just a brief map of where we found redemption locations for both nutrition incentives and the produce prescriptions programs. So across those 9 counties, we found 126 redemption locations, covering 4 large-scale nutrition incentive programs, and then 38 redemption locations for produce prescription programs, covering 3 unique produce prescription programs. So just looking at this map, as you can see, the areas around Buffalo and Rochester are highly represented. Lots of the rural counties and other rural areas were not represented very well, which we'll touch in on some of the barriers and enhancements that we have recommended in the report. So to put the report together, we did a few different research methods. So we looked at basically program participants, current participants, and those who might not be able to participate due to barriers. So we incorporated quite a bit of customer feedback from our Double Up program and our customer service channels. And then we also had customer feedback from other programs that were relayed through their operators. We also spoke directly with the program operators through a variety of surveys and interviews, as well as an analysis of public-facing materials on websites, social media, other outreach channels. And with that, we basically tried to put ourselves in the shoes of a potential participant interested in accessing these programs, and kind of go in maybe not knowing a ton about the programs, maybe knowing a little bit, but just seeing what it looks like for a potential participant. So some of the research trends that we found among participants, we heard some very positive feedback. These programs help families stretch their food budgets and improve access to fresh produce. Definitely some challenges as well. Too few or hard to find locations. And then many customers find the program process or the process for accessing these programs confusing. As far as program operators, again, some very positive feedback from them. There's significant potential for growth, and an immediate positive impact on customers who are able to access the programs. Challenges, kind of across the board, funding remains inadequate or inconsistent, specifically funding around funding growth in these programs. And then also, many programs had difficulty reaching all eligible customers within a service area. So a few of the key barriers to access that we identified, major service gaps in rural areas and rural counties, specifically lack of year-round operations in these counties. So we'll see farmers markets and farm stands that might operate seasonal, but that don't operate during the winter months or don't operate in the early spring. We saw limited customer outreach and awareness. It's not necessarily a if you build it, they will come solution. You definitely have to let customers know about these programs and how to access them, and hopefully how to access them in an easy and convenient manner. Challenges in program expansion administration. With that, we heard staffing and having staffing levels that can scale with program growth being one of the major barriers here that limited expansion. And then inadequate and inconsistent funding. Again, tied directly to growth. It's hard to grow if you're not sure that your funding in the next year will allow for you to grow. And the flip side of that, we did recommend some program enhancements in some areas of operation or in areas of opportunity to enhance programs. So we recommended focusing expansion efforts on hub cities in rural counties to help breach that rural gap. So those are county seats or other cities or towns in rural counties that might have large healthcare operations for the county, might have the grocery stores, might have other kind of county-wide services that more folks are coming into. We recommended establishing regional and statewide coalitions in coordination among these programs, coordinating expansion to reach high-need areas, lacking access, as well as aligning outreach channels and messaging for all programs to reach a broad audience. Double Up Food Bucks might not necessarily be the program in your backyard, but if we could recommend Double Up Food Bucks among some of the other nutrition incentive programs, there might be one covering your area. We also recommended developing or working on standardization of program administration practices, basically find a way to scale these programs efficiently in a way that lowers participant confusion and might help increase uptick of these programs. And then as well as advocating for the establishment of stable funding sources, be that at the federal and state government level. Yeah, so that is some of the main findings from the landscape assessment. I also want to touch on, like Julia mentioned, there's going to be a delay or likely delay to SNAP allotments for November on Saturday here. So I really want to touch on how some of these voucher programs can help SNAP households that might not have the full allotments for November. So the first off is if any households have leftover SNAP balances from previous months, we'd recommend them shopping at a nutrition incentive retail location to help stretch those remaining dollars as far as they possibly can. We fully understand that's not a reality for many households. And then many households tried to spend down their incentives in October as quickly as they could just due to uncertainty. We also would like to kind of call out that many households might have unspent vouchers, be it from a produce prescription or nutrition incentive program. This can take the form of paper vouchers or coupons, tokens, loyalty card or store balances. We see many Double Up Food Bucks customers kind of save up their earned Double Up Food Bucks for an emergency situation. So we would definitely recommend that they tap into some of those funds if they have them available. And then we would also recommend focusing outreach efforts on both. I know we are doing this personally as a program on reminding participants that they might have unspent currency and then encouraging them to spend it at participating locations. And then, of course, making sure they have all the information they might need about the emergency food assistance networks, food pantries in the areas, food banks, 211 as well. And I also want to end on just a few of the programs that we want to highlight. This might be helpful for November as well. I didn't list out the produce prescription programs since many of them tend to be referral based and time limited. And similarly, I did not list Glenwood CSA as a SNAP program, which is in the landscape assessment because it is very seasonal and it's a cohort-based program. So I'm not going to go through all of these. I just want to note that FMNP coupons are still active. And the last day to spend those is November 30th. So many folks across the state might have access to those. And I would encourage them to spend them before the 30th. Fresh Connect checks run by New York State Ag and Markets is another major program. Double Up Food Bucks, of course. And then the New York City Department of Health Health Bucks program and Get the Good Stuff programs operating within New York City. So
Jake,
that
I
is,
have one follow-up question, just for those
yeah,
who are less familiar with why they should be using any unused SNAP benefits at nutrition incentive retailers. Can you explain how that,
yeah,
and why
absolutely.
that's helpful?
So calling out a few of these programs while they're on the screen. So Fresh Connect checks, Double Up Food Bucks, Health Bucks, and Get the Good Stuff are all SNAP match programs. So folks that shop with SNAP at those locations will receive basically a doubling of their food dollars that they spend with SNAP up to a certain amount. So with that, if you're at a Double Up Food Bucks Farmers Market, you can spend up to $50 of SNAP and you'll receive $50 of Double Up alongside that, basically immediately doubling your purchasing power up to $100. Health Bucks, Get the Good Stuff, and Fresh Connect all operate in similar ways.
Great,
Great.
thanks so much. So, Ashani, New York State Department of Health was a co-author on this report. It'd be great to hear from your perspective why the agency was interested in this information, why you think these kinds of programs are important, and how the Department of Health plans to use this information going forward.
Sure, definitely. So yes, I know Jake touched on some of this already, but I will definitely add some more background information. So the department receives funding from the CDC to implement the State Physical Activity and Nutrition Program, or SPAN, as Jake had mentioned. And this program is to help address health disparities tied to poor diet and physical inactivity through some key priority strategies. And so we partnered with Field and Fork Network to help with one of these priority nutrition strategies, which is the expansion of existing fruit and vegetable voucher incentive and produce prescription programs. And this was to help make healthy eating more accessible. So just some, you know, key facts. So in New York State, there's about 3 in 10 adults who experience food insecurity, and about 10% of households report food insecurity. And this is more common in families with children. And so access to affordable healthy foods like fruits and vegetables is limited for many. And this highlights structural barriers and inequities that exist. So nutrition incentive and produce prescription programs are 2 evidence-based public health initiatives that aim to improve the consumption of fruits and vegetables for households with lower incomes. So the department better wants to understand the state of these crucial programs statewide, which is where Field and Fork Network's landscape assessment has been key. As Jake mentioned, this information has helped us to understand existing programs across the state, identify gaps and barriers, and where there may be opportunities for improvement so that we can appropriately work to strategize the expansion and enhancement of nutrition incentive and produce prescription programs. This assessment was from the SPAN program year 1 and was intended to and has informed the development of an action plan for years 2 to 5 of the grant. So we are continuing to implement an action plan in year 3. These programs are essential in decreasing nutrition insecurity across the state and addressing diet-related chronic diseases, especially among lower income and underserved communities. And so ultimately, we hope that using this information from the report, we can address one of the priorities of the 2025 to 20 30 New York State prevention agenda, which is to improve consistent and equitable access to healthy, affordable, safe, and culturally appropriate foods. So we're very excited to continue working with Field and Fork Network to strategize and move forward in decreasing food and nutrition insecurity across this state through these very important programs.
Thanks so much, Ishani. That's great. So Jeff, we heard from Jake and from Ishani why, from a public health perspective, these programs were of interest. I'm curious to hear your perspective. So, as someone who works on the for-profit side, why are these programs interesting, and what has your experience been like participating in, produce prescription and nutrition incentive programs?
Yeah, so how it's interesting, right? Is I have, like I mentioned in my opening, I've been in produce for 40 years now, and I've been on a lot of the associations out there, IFPA, PMA, all those things. And
Can you tell people what IFPA and PMA
oh,
are?
I'm sorry,
So
International
many people
Fresh
probably
Produce
don't know.
Association. PMA was the Produce Marketing Association, and United Fresh Produce Association. They actually merged. And I'm also on the board of the Southeast Produce Council. And one of the things that all these folks have in common is that we want to increase the consumption of fresh fruits and vegetables. We know it's not just critical to our business, but we know how critical it is to the entire, just the population in totality, how important it is. So we know we're doing the right thing. So when this program, I wouldn't say it fell into my lap. I received an email. It was funny. I was just looking back at my emails, and it was October of 2022. So it was literally 3 years ago. And, I reached out to the Field and Fork Network, and Jake was on the team, and we reached out and we started, say, how can we, get this into our, our stores? Can it work in a grocery store? And, we started working, and it did take some time, but we did get it up and running by July, which I know seems like a long time, but when you look at the program and some of the things that are involved, and it seems good. It was good. It worked out for us. But why it's an interest, right, is so one of the things that I've been in privy to see is SNAP benefits, where the bulk of the sales are going and what folks are buying on SNAP. And sometimes it was frustrating as a produce person because produce wasn't always the top of the list. It wasn't. Understanding there's a lot of things. And in fact, a lot of instances it didn't come till the 10th or 12th item in a lot of instances. So when this program fell on, into the lap, for lack of better terms, wow, I said, so we can take the dollars and it's going to go right to produce. And obviously it's just the right thing to do, and for all the right reasons. So that's really what drove me and the company, because we, obviously the company, the company I work for, we care a lot about the communities. We want to try to help folks. And this was just one of those programs that checked that box.
Jeff, obviously you were saying like SNAP produce wasn't always at the top of the list, and that makes sense. We hear from people all the time that with purchasing, oftentimes they'll use SNAP to do, bulk purchasing or larger purchasing of shelf-stable things because it's guaranteed money and they can buy it with a lump sum at the beginning of the month when they get their benefits. I'm curious to hear, I think produce is famous in grocery stores as being sort of like the most difficult to manage section. And I'm curious to hear sort of like what have been the challenges in operating this program and how you've navigated them.
Yeah, so really the challenge is it really started with the communication that we actually had the program, right, to the customers. There were a lot of things that were involved on the front end, where there was a lot of tentacles, a lot of folks we had to talk to, about making sure it would work, the way the coupons come out, things like that. We were trying to make it as easy and simple for the customers as we possibly could. And, when we did the test, I wanted to say this is that we do a lot of programs with coupons and things like that, and the redemption rate generally in some of these stores is very, very low. And
For coupons or for
coupons in general,
Okay.
whether we specifically, at Tops at the time we were doing these super coupons or the FSI coupons, and digital coupons now are obviously running rampant. Redemption rates were really low in those stores in particular. They just were. Then we brought this in and we've seen, 5 times the redemption on this program. So we know obviously it's working. But there were a lot of things we had to check. You know, it was really about education, not just our store teams, you know, the registers and things like that. You know, getting the stores signed to say, hey, you know, we really did that. We rolled out, you know, signage to let the customers know. And of course, there was boots on the ground as well, where the Field and Fork team would come out, they would sit, they would talk to folks as they come in. So when you say what's the challenges, I mean, it's produce is a tough thing to manage, but we always want to sell more, and we always have more to sell in, and it just helps us turn the product better, so it keeps us fresher. And another big focus for us that I thought was nice, and it was that we really tried to focus on locally grown produce too in New York State, and where we could. Again, we're such a great agriculture state, you know, from apples, cabbage, corn, you name it. We have just a ton of stuff, not just in the season, but we have it year round. And, you know, it's really nice to be able to tie those things in together. So, but yeah, from a complexity standpoint, everything that was a challenge certainly was worth it. We worked through it, and yeah, the team at Field and Fork really made it very easy.
Jeff, I have one more if I can take the prerogative of facilitator here. It's just much rarer that we have a business perspective. So what I've heard before from other retailers in other states, I used to work on supermarket issues in a previous role, that cashier education is often a big part of this. And I'm wondering, I think Field and Fork has told me that too, but I'm wondering if you could talk a little bit more about sort of like, I think we all struggle in our own organizations around internal communication.
Right.
How you've done that.
Certainly was. And I would be lying to you if you could walk up to every cashier in every store that's offering double up food bucks and that they all knew exactly what was going on. They don't. But what we do have is we have teams at both Price Chopper, Market 32, and Tops that work at the stores. They're constantly there educating, re-educating folks on what exactly it is and when that coupon comes out. What that means to the customer. Hey, hold on to that. You know, you can get, so it's a challenge. It is. And it's always going to be a challenge. But it must be working because we continue to see, you know, strong redemptions. You know, so the word is getting around, and I think, you know, it's also nice, right? Because cashiers stand next to each other, so maybe they overhear things, but we do have a team that focuses on that, and yeah, but it is a challenge for sure.
Thanks so much, Jeff.
Mhm.
So Jake, we've just heard the business perspective and how sort of organization internally matters so much. Field and Fork has been so successful in spreading these programs across the state. You know, predating me, NYHealth Foundation, I think, funded Field and Fork to do this in a handful of farmers markets. And now you're in, you know, nearly the entire state with hundreds of site locations. I'd love to hear about sort of like, to what do you attribute that success, and what are you doing internally to think about growth? Because it's such a challenge for every organization.
Yeah, absolutely. And just to put a couple of numbers, I know this was shared in the webinar description out with everyone. So we're at close to 400% growth for 2025 when compared to 2024. So
And is
um,
that dollars or stores, or what is that?
dollars mainly. Yeah,
Okay.
dollars in transactions. So anytime a customer kind of interacts with the program. So a lot of that we can contribute to our partnership with Jeff and his team over at Tops Price Chopper Market 32. And to put some more numbers on it, we've expanded into 75 new full-scale groceries with them across 34 counties of upstate New York. And 16 of those counties are new to Double Up Food Bucks. So I think a big part of the success in that is also the way we've approached outreach and customer outreach around some of those new counties and even the existing ones. My colleague Chloe Cabrera has really focused in on outreach to many like client-facing organizations. So whether that's a county social service department, a county health department, food pantry networks, and just other participant facing nonprofits. I can't even count how many meetings she has had with teams, just telling teams about Double Up Food Bucks and then giving them the outreach material needed to spread the word to their clients. And then just to reiterate a little bit of what Jeff said, being able to kind of standardize double up operations across all of the 77 Tops Price Chopper Market 32 stores has been extremely helpful. I know cashier training was touched on, and that was definitely one of the most difficult and time-consuming parts of launching a new Double Up location. With the Northeast Shared Services team, we were basically able to institutionalize that and do a train the trainer model. So we worked with their training team, made sure they had all of the information they needed about how Double Up operates in those stores. And they're able to create a standardized training module for all store associates, customer service, store managers, you name it. They were basically able to make sure the information got in front of them, as well as refreshers. I'd say the same thing as far as in-store marketing. We were basically able to work with their team, create a bespoke marketing package for Double Up Food Bucks in Tops, and then Double Up Food Bucks in Price Chopper Market 32. And just had consistency across the stores on how we kind of did in-store marketing to customers. So no matter where you are, if you're at a Tops or Price Chopper Market 32 that participates in Double Up Food Bucks, you know there's going to be marketing material up, both educational and just awareness for customers to kind of realize that they can participate in this program at those stores.
And Jake, I'd be curious to know, it's been a chaotic time since you released the report, but like, did any of the findings of the report change how you were thinking about your operations or contribute to those decisions, or are there coming changes, I guess, as a result of the report?
Yeah,
Not a
absolutely.
question that we had talked about before, so I hope you don't
Yeah,
mind.
no, absolutely. And just kind of going back through that small slideshow I did, that basically the strategies that we recommended were the ones we followed with the Tops Price Chopper Market 32 expansion. So I mentioned we were in 60 new counties. Almost all of those were rural counties spread across central New York, the southern tier, Adirondacks, and then I'd say like the Mohawk Valley as well. So those were areas that Double Up had not currently had a presence in, and many of them were rural counties, and we were able to identify the main city or town or two main cities or towns in those counties. Luckily, many of them had a grocery store that Northeast Shared Services ran. So we were basically able to kind of plug in, again, with the standardized Double Up package we had for those stores.
Great, thanks.
Mhm.
Ashani, Jake was talking a little bit about sort of like gaps there, and I'd love if you could talk more about the difference in sort of consolidation or participation in rural and urban areas and how you're thinking about that.
Definitely. So I'm sure many of us know, and as Jake mentioned, the rural areas often experience greater barriers for many things, but especially in accessing healthy foods. And as the assessments show, there's a greater concentration of nutrition incentive redemption sites in urban areas as compared to rural. And so, I mean, pretty broadly, and this is what some of the action items are we're hoping to focus on in the next few years of the grant. We need to increase awareness, outreach, partnerships in rural areas to better serve them and those communities. So I think a lot of it is, as Jake mentioned, working on those strategies, making those connections.
Great, thanks so much. So a final question to you all, and then we'll open it up to the questions. There's a lot of questions in the chat, so we'll get to those. I'm wondering, what changes would you like to see when it comes to policies, programs, or funding? And are there any concrete actions that people who are attending today can take to support these programs or get involved? And Jeff, you look ready to go, so
I'm ready. Well,
first.
what would I like to see? Sure. So it is, I could listen to this thing and I'm like, wow, we are taking these dollars and they are buying fresh produce for the folks who don't have access to it. Talk about an ROI. I mean, I want to see this thing continue to expand. What other thing can you say? It's a direct correlation to fixing a problem that we have. Right now, this is hitting it. Those dollars are going to fresh produce and in an area where it desperately needs it. So I would just like to see, increased funding, expand this, And yeah, it'll just be greater for the, obviously, state of New York, for sure.
Jeff, and I can't help but take the moment to say, we hear from our emergency food partners all the time that meat and fresh produce are the #1 requested items. They're really hard for food pantries to manage, right? Because of, using your industry term, shrinkage, right? And the program is excellent in that it provides people with the ability to go when suits them to a place that is set up to manage produce effectively.
Right.
And so to your point, like when we think about these programs and when we think about SNAP, like we should be investing in letting people purchase their own foods right now. And that's really the priority. I'm off my soapbox and I'm going to hand it to Jake or Ashani.
Yeah, I can jump in. I will definitely echo Jeff's comments about funding and yours as well, Julia. Just having consistent funding for these programs across the state and then consistent funding with enough built in for continued expansion. A lot of our year-over-year funding is stable funding, which is great. But just making sure we have it scaled to again allow for the large scale expansions that a lot of these programs are primed to do. Definitely have to kind of acknowledge that these programs are going to be helpful, but definitely many of the SNAP match programs are going to be struggling to help people without SNAP allocations in November. So I'd recommend folks staying up to date on New York specifics with that OTDA link that you initially shared, Julia. They're going to have the most up-to-date information for the states. And then also, I'd encourage states to reach out to congressional representatives and the USDA directly and just make sure their voice is heard about getting these benefits out to the folks as soon as they can.
And Jake, can I ask a clarifying question about funding? Can you talk about the federal and state funding sources specifically so people understand if they're interested in advocacy, like where should they be directing it or what's the best place and how much money,
Yeah, absolutely. So I can speak to Double Up specifically. So we receive a state allocation every year from the state legislature of New York. We have been working to get in the executive budget going forward, which allows for, instead of getting re-upped every year, it allows for basically carryover funding as far as I understand it. We also receive a Gus NIP grant. So it's a Gus Schumacher Nutrition Incentive Program grant that is managed through NIFA, which is in the USDA. So it's a federal grant. So those are the two main funding sources for nutrition incentive and produce prescription programs kind of across the country at this point.
Great. And actually, I'm going to ask one more because I can't.
Yeah.
What about that program? What is funding looking like for that federal program right now?
For the federal program, so for Double Up Food Bucks specifically, we have funding through 2027. Right now with the government shutdown, not a lot of communication has come out around the future of the program going forward. But there's cohorts basically that exist for the next couple of years here with funding.
Great, thank you. And Ashani, last but not least, sorry.
That's okay. Yeah, I mean, I agree with what Jeff and Jake were talking about. Obviously, sustained funding is key. But also in terms of what everyone can do to support these programs, I will urge everyone to look. There's a link, hopefully someone can share that to the CDC webpage. And this highlights 7 key public health actions for partners to support the expansion and enhancement of fruit and vegetable incentive programs in the state. So at its core is the community involvement and equity practices, and the goal, of course, is to increase uptake and expansion of fruit and vegetable programs. So each of these public health actions, for example, building capacity for implementation with partners and sites, leveraging policy opportunities, and securing complementary funding, et cetera, can be supported through various state and local activities. And there's examples under each of the actions of what activities you can participate in. So please take a look at that and see if any is or something that you can be involved with.
Great, thanks so much. So now turning to the questions from participants. I guess the question is, can you share if you're evaluating a specific program? So that Jake, that's probably for you, but also Jeff, if you do internal evaluation too, and you know, who could talk more about that?
Well, I would say Jake could probably talk more about it. For our evaluation, it's just been a success. I don't know what else to say other than we just provide feedback to them to how do we continue to educate the customers about it. So.
And it sounds like you said you've done some evaluation in the terms of like it's 5 times. Did you say that 5 times more successful in terms of coupons than normal?
Yes.
Yeah. Yeah. So on our end, we have a third-party evaluator for Double Up Food Bucks, the Action Research Collaborative out of Cornell. I'm assuming a few of them are on this webinar right now. But with them, we basically dive into all things Double Up. So looking at, are we making the greatest impact that we can across New York State? Is this program working for customers? What customer feedback can we get and implement on it? So really a wide variety of evaluation on the program. A lot of that has kind of informed how we've partnered with TOPS and those expansion efforts that we kind of talked about there. And then I also just want to, this is a little bit off topic, but I just want to make sure we kind of cover how Double Up works at TOPS, Price Chopper, and Market 32, and just kind of the simplicity of it for customers. Basically, a customer goes in, spends SNAP on produce, and that basically flags that purchase, and they receive a coupon of a matching amount up to $20 a day for free fruits and vegetables on their next visit to the store. So really simple, and I think a big part of it is really just awareness, and I think Jeff mentioned this as well, of just making sure folks that are receiving Double Up Food Bucks in these stores know that they're receiving it and know that the coupons are free fruits and vegetables is a big part of our outreach right now.
And Jake, relatedly, someone was asking in the chat that they're involved with another program that is a nutrition incentive program that is at a different dollar amount and is distributed a little differently. Can you talk about like how sort of the variety of like distribution methods or amounts that you saw in the landscape assessment?
Yeah, so I'd refer the folks to the full report. But yeah, so it really just varies based on the program operations and what they think they can support at the level of their current operations. So I can say for Double Up Food Bucks, we're pretty standard at $20 match per day in grocery locations. And then we have a $50 match per day at farmers markets, farm stands, mobile markets. Just realizing that those don't always have the kind of set hours of operation that grocery does. They might just operate one day a week. So theoretically, a customer could go to a top store every day in a week and kind of match their basically the SNAP they're spending on produce every day if they have enough SNAP out there. So but yeah, it varies across the country and across the state. Yeah. So, and that's all in the report. I don't have it pulled up in front of me, so I don't want to go off the cuff saying the wrong answer to anything.
Of course. This is probably a two-part question. So someone was saying, you know, that people in their rural county aren't as familiar with some of the root vegetables that can last a long time and that are, you know, produced there within the county. I think New York, we're great at root vegetables. And they're wondering like what kinds of, are there taste tests or recipes that can be given out at retail markets or participating? And Jeff, I imagine working 4 decades in the produce section, you have some ideas about this. So
Yeah. Yeah, no, I agree. I mean, I think one of the biggest challenges we have is educating the customers, and that's always going to be a challenge. So we constantly are trying to get recipes out there at any point. We try to meet them at, where they're at, whether it's digital, in store, if they're looking at print ads. So we continually try to do that because to the question, right? It's a challenge, and it is something you can stock up on, and you can stretch it, and yeah, and it's good for you, right? So
Are there like within your industry, are there educational activities that are seen as like, I don't know, do you have an example of like what's been successful in your own career or just generally like what's considered standard practice?
So I'm always my experience because I is boots on the ground. I love talking to people. I think when you make a connection with someone, that's when you can do it best, right? Because you can get your passion out there, your knowledge, and you can really influence one person. Unfortunately, there's only so many of us to go around. So that's where I would say, the best way is to continue to hit them digitally with recipes and just, we know what people are looking at. Obviously we have all the information now. We know what they're looking at, whatever, Facebook, Instagram, whatever. We can hit them where they're at. We can talk about those things. So those have been successful when, you can get thousands of views. You're assuming that people are absorbing some of that.
I mean, when I hear you say boots on the ground, it just reminds me of just how hard sort of our public health infrastructure has been hit right now. So SNAP Ed is a program that brought millions of dollars into New York State and covered the important staff time of people to do things like cooking demonstrations. And that program has been completely gutted. And it feels upsetting, especially upsetting when we're thinking about, what we know works
Right. We know it works.
Yeah.
We do. We know it works.
Yeah, and to that point, Julia, we over the years we have had a great relationship with SNAP-Ed, both regionally and across the state. I saw Shayna posted their recipe. They basically have a large repository of recipes. Yep, of course. Thanks, Shayna. And we definitely took the opportunity to partner with them whenever we could. Their whole goal was basically nutrition education, which wraps up perfectly alongside Double Up Food Bucks. It's like, look at this recipe, go use Double Up to go buy some of the ingredients of it. So yeah, so that was definitely a big part of our nutrition education is that partnership. And yeah, just like Jeff said, just providing recipes can be a great way to go, but definitely is not the end all be all to a lot of the education around it.
Shani, I see you off mute. Were you going to chime in?
But yeah, I think some of what Jake said, but also like some of the produce prescription program models also include nutrition education as well. And so that's another place that this could be tied in and focusing like on seasonal produce. I'm sure it would be helpful too.
As you know, as a healthcare provider, I'm wondering, we often hear that it can be difficult to have time to even talk about these sorts of issues with your patients. And, that sometimes doctors just don't have the training in nutrition. And I'm wondering if you could provide the healthcare perspective and tell us a little bit about like how you were thinking about these programs.
Yeah, definitely. I mean, that's what led to helping with this project. And so, yeah, it's a struggle. There isn't enough time in a visit to help families, understand and learn about nutrition. And even if there is, or even the little amount we can discuss with them, what about all the other barriers that exist, right? It's beyond that clinic visit. And so that's why these programs are key, but I think this is where the communication and education and outreach to these, like to the clinics, to the providers, the provider, like there's a team of people that you see when you go to a doctor's visit, whether it's a social worker or a medical assistant, someone, it's just a matter of saying, here are resources, here are places you can turn to, places you can, or sites you can visit to learn about what might be helpful to you. So, we are working with Field and Fork Network to create a webinar, again, to fulfill this purpose. Like one of the gaps identified was people aren't aware, whether it's public health partners or clinicians, or other community-based organizations. So helping to educate them on this webinar will focus specifically on produce prescription programs. And so how all these partners can become involved and the roles they can play in helping to expand these programs. So hopefully that answers.
Yeah, I mean, from a funder perspective, we have, some unanswered and maybe unanswerable questions around engagement with healthcare from a food perspective right now. We had been funding some work to be thinking about better linking WIC and Medicaid and what that would be at the provider level, what that could look like, and what sort of advocacy would be needed to support it. And we remain committed to that, but we are also just very worried about, what the capacity of providers will be with Medicaid cuts coming and how strained the system will feel. And so, people talk about WIC sometimes as like the original, I think the report even says that, like the original fruit nutrition incentive program, right? And so, I know that other grantees were thinking about outreach with healthcare and WIC. And so, if this very well-established program where people are already trying to create healthcare linkages is a little bit having these questions, like I can't help but feel like this newer program, despite its like very big success so far, will also have trouble like linking with healthcare, though, we've shown proof of concept with produce prescriptions in New York already, right? All right, I think we are sort of reaching the end of the questions. There's a lot of great chatter. And so I will just, before I sort of close out, I will ask if there are any sort of like last comments, questions from the panelists, anything that we didn't cover that you'd like to make sure gets covered.
Yeah, no, I'm all set. I appreciate the invite and yeah, it's been great. I wait for the day when I go to the doctor and he says, take 2 bananas and call me in the morning. They have yet to do that. They always prescribe me something. Oh, your blood pressure. I could just eat bananas. So that's something we got to work on. But yes, thank you.
Great.
Yeah, on my end, I would just encourage everyone to kind of stay up to date on the November SNAP allotment delays. With that OTDA website, that's going to be the most up-to-date information. I'm happy to post my email in the chat if everyone has any follow-up questions going forward. Happy to answer those off the webinar.
Jake, I think someone's saying they want updates, and we will certainly send a recap, but if they want to stay on a list or something like that, is it best to reach out to like go on your website or?
Yeah, so you can definitely sign up on the Field and Fork or Double Up Food Bucks website if you're interested specifically on the OTDA updates around SNAP allotments. Getting the information directly from them is what I'd recommend, just because they have real-time updates on that website. Also, you can follow them on social media. That's also they've been posting updates as they get them coming in. So if yeah, if that is what the person is asking about, I'd recommend kind of making sure you have that bookmark or that website bookmarked and then following them on social media.
And if there's any questions for us, I'll put an email here in the chat as well. Just give me 1 second. But please visit the websites that were provided and try to support these programs the best way you see fit. But thank you so much for having me too.
So a big round of applause to all our panelists. Thank you so much for being here to talk about this really important topic today. We will be sending out a webinar recap today, tomorrow or the next day, Friday or Monday, likely with links that are here, copies of the slides and link to the actual assessment. I would also say, if you're looking for more information on SNAP, we have included the OTD website that Shani mentioned again there, and Hunger Solutions New York is a great advocacy organization that sort of coalesces all of this information for individuals as well, and so you can look there. But again, thank you all.